Hello everyone, myself Rahul Ashok, pursuing my Bachelor of Physiotherapy degree from Marward University, Rajkot, Gujarat. So today in this video, I am going to talk about bed ragaz technique. So introduction. So it's an aquatic therapy technique which is developed in the bed ragaz in Switzerland. So it's a specialized technique in the exercise therapy and which is help in the physiotherapy rehabilitation. And it is based on the PNF technique, which is a proprioceptive neuromuscular function. Proprioceptive neuromuscular facilitation. Okay, so proprioceptive means it is the ability to sense the joint position, and neuromuscular means it is related to the nerve, and facilitate to it means to make task easier or initiate the movement. Then the patient is supported by the flotation device. Here you can see the patient is supported by the neck ring and the arm ring. Then the therapist, you can see the therapist is applying the manual resistance, and the movement is done, and it is performed with the warm water. Means it is depend on the temperature gradient. Means you can set the temperature based on the patient tolerance. Now the history and origin of the bed ragaz technique. So it is developed in the bed ragaz as we have seen earlier in Switzerland. Then it was started in the 1930s, and later it was combined with the PNF technique. And now in modern, the bed ragaz ring method is developed during the 1960s to 1990s. Now we'll see what are the principle of bed ragaz technique. So first one is buoyancy. So buoyancy is the upward force that is provided by the water to the body, and which reduces the body weight and allows easy movement. Then the warm water relaxation. We use the warm water to relaxes the muscle, reduces the pain and stiffness. Then the hydrostatic pressure, which enhances the circulation, which will increase the circulation in your body and helps in the reduced swelling. Then the PNF diagonal pattern. So in the water, the therapist will perform the PNF diagonal pattern like D1 flexion extension, D1 flexion extension, and D2 flexion extension. Then the water resistance, the water will resist the body, so it will provide uniform resistance in all the direction. So here you can see the buoyancy, hydrostatic pressure, the water resistance, then the warm water relaxation, PNF diagonal pattern. Here you can see. Now we'll see what are the equipment which is used in the bed ragaz technique. So neck ring, pelvic ring, arm floats and ankle float. So in this image you can see here is the neck ring, the arm ring, the pelvic float, the pelvic ring and the ankle float. So these are the device which will help the patient to be on the above the water for the flotation. So patient will not drown in the water. Then the technique means the procedure. So patient floats in the supine position. First of all, we have to check for all the contraindication. Then we have to start the technique. So first, the patient will be in the supine position. Based on the patient condition, you may choose the position. Then the therapist will stand in the water on the waist level. Then the therapist provide manual resistance. Here you can see the therapist is applying manual resistance. Then the patient perform PNF movement pattern like D1 flexion extension, D2 flexion extension. Then how bed ragaz technique is performed. Okay, so method. So I earlier told that check for all the contraindication, then start the treatment. So after that, the therapist grasp the patient. Like the patient will be in the supine position based on the condition. Then therapist will grasp the proximal or distal part for the movement. Then the specific PNF movement pattern is selected, like which movement we are going to perform on the patient. And the patient perform movement against the resistance. Like if we are applying manual resistance downward, then patient have to push upwards. Then the therapist controls speed and direction. So therapists have to maintain a particular speed and the direction for the easy movement. And the last, resistance is adjusted according to ability. So we have to apply the resistance as per the patient tolerance, not that much. Now the types of exercise will be applying on the bed ragaz technique. So we can give trunk stabilization, pelvic control exercise, upper limb strengthening, lower limb strengthening, gait related movement pattern, then the balance and coordinate. So these are the exercise will be given in the water, like gait training. We'll put the parallel bars Here you can see the parallel bars. It is not in the water, but we can keep the parallel bars and may give gait training. Okay, then the flotation exercise, then the strengthening of upper limb and lower limb muscles, all we can give. Now the therapeutic effects, like what are the benefits in the water when the patient is doing the exercise or any treatment. So buoyancy will reduces the body weight. So because the buoyancy will apply the upward force to the body, so it will reduce the body weight. And the hydrostatic pressure, which will increase the blood circulation in your body. And the water resistance that strengthen the muscle. And warm water reduces pain and spasm. So I told that we have to set the temperature of water, like we have to make the water warm only, so it will help in the reducing the pain and spasm, and hence it will improve the range of motion. Now the indication of bed ragaz technique, in which condition we can give this bed ragaz technique. All the patients are not suitable for the bed ragaz technique. So first, the neurological condition like stroke. So in stroke, multiple sclerosis and cerebral palsy. Then the rheumatological condition like rheumatological arthritis, fibromyalgia, and orthopedic condition like arthritis, that is the joint pain, and the post-fracture rehabilitation. After the fracture, we can rehabilitation in the water. Then the low back pain, the pain in the lower back area. Then the balance disorder. If the patient is having balance disorder, we can give him or her the balance disorder. Then the muscle weakling, which will strengthen the muscles. Now we'll see the contraindication. So before applying any technique, you must check for the contraindication. The first is open wounds. Will not give this technique in the open wounds because it will worsen the condition. Then severe cardiac condition in which the patient will feel breathlessness. Then the uncontrolled epilepsy. We have to take care of the epileptic patient because it will worsen the condition. Then the active infection will not give in active infection because it will increase in the patient body. Then the fear of water. So we will not give in the patient who is having hydrophobia. But if you want to give, we have to be in supervise the patient continuously. Then the severe respiratory distress. Then the severe hydrophobia. The patient who is having phobia with the water, so we will not give in that patient. And the last, urinary incontinence, means will not give the patient in urinary incontinence because the patient will continuously urinate in the water, and that will make the water unhygienic. So here you can see open wounds and uncontrolled epilepsy. These are the examples which have been taught. So now we'll see the advantage and limitations. So here are the advantage, like bed ragaz technique advantages. So it will reduce the joint stress because the patient in the water, so it will feel less load on the limbs. Then the improved muscle strength because the hydrostatic pressure. Then the better balance and coordination, and the increased patient confidence. Then the limitation, because the limitation it requires the pool and equipment, because if you have a smaller clinic, so you cannot have this larger area because it needs a larger area to be having this technique, and needs a trained therapist because you need a proper therapist for this bed ragaz technique. And the last, it's not suitable for each and every patient. So the final slide conclusion. So at the end, I would just like to conclude that it combines the hydrotherapy and PNF technique, and it is effective in orthopedic, neurological, and rheumatological condition. And it uses the buoyancy, resistance, and therapist facility. And these are the principle of bed ragaz technique, and it will improve the strength, mobility, balance, and functional activity. Thank you for watching.